Our next presenter is Dr. TARUNI Kumari, topical timolol for treatment of conjunctival pyogenic granuloma.
Good evening everyone. Today I am going to present on topical timolol for the treatment of conjunctival pyogenic granuloma, outcome and effect on IOP. Pyogenic granuloma is acquired vascular lesion commonly seen on skin and mucosal surface. In eye, pyogenic granuloma are typically seen on palpebral or bulbar conjunctiva. Conjunctival pyogenic granuloma develop as a result of inflammation from eye surgery, lesion or any other ocular trauma. Common clinical presentation include foreign body sensation, irritation, mass and rarely pain. Topical steroid is the most common form of treatment in a case of ocular pyogenic granuloma. Surgical excision is the next preferred treatment in steroid non-responder or recurrence case. Alternate treatment of pyogenic granuloma is topical timolol with minimal side effect. Topical steroids are known to cause rise in intraocular pressure. It can cause ocular hypertension with 6 to 15 mmHg rise in IOP. After 4 to 6 weeks, used in 30% of the healthy patient. The RAS pathway has implicit in angiogenesis and vascular proliferation through hypoxial inducible factor 1 alpha and vascular endothelial growth factor. Beta blocker work by inhibiting hypoxia inducible factor alpha and vascular endothelial growth factor, leading to apoptosis and endothelial cell involved. Now, aim of study to determine the clinical outcome of 0.5% timolol malate eye drop for the treatment of conjunctival pyogenic granuloma and its effect on intraocular pressure. This is hospital-based prospective interventional study done between January 2021 to August 2021. 11 patients with the conjunctival pyogenic granuloma who were prescribed 0.5% timolol eye drop included in my study. Patient evaluated with the slit lamp examination and IOP measured by the applanation tonometry. Visual equity noted in each visit. Patients were followed weekly up to the 8th week. IOP were measured before treatment, while on treatment, and 8 weeks after treatment. Treatment aborted after 8 weeks if resolution not noted and surgical excision undertaken. The data analysis include the following parameter like A6, location, antecedental history, duration of complaint, previous treatment, duration of treatment, and pre-treatment on treatment. All patients diagnosed with the pyogenic granuloma were included in my study. Exclusion criteria include recurrent pyogenic granuloma at the presentation follow-up, previous diagnosis of glaucoma or ocular hypertension, pregnant women, patient with a history of bronchial asthma were also excluded. Out of the 11%, 54.5% were female and rest male. According to this bar diagram, most common predisposing factor for development of pyogenic granuloma is lesion followed by the unknown origin and trauma. The mean IOP of the affected eye at the presentation was 15.1 mmHg. 1 week after the initiation of therapy, the mean IOP was 12.1 mmHg. Palpebral conjunctiva is most common location of pyogenic granuloma in eye. Out of 11%, 9% had complete resolution of pyogenic granuloma at the end of 8 weeks. First diagram show the patient at the time of presentation, second diagram at the 4 week of treatment, and third diagram at the 6 week of the treatment. Now discussion pyogenic granuloma occurs secondary to local tissue hypoxia with traumatized endothelial cells which result in expression of the growth factors such as vascular endothelial growth factor and basic fibroblast growth factor, leading to the aberrant healing and the eventually mass formation. In addition to corticosteroid, the other treatment modality used in treatment of ocular pyogenic granuloma include cryotherapy, electrocortic topical antimetabolite, intralesional steroid, and plug irradiation. Side effect of steroid include steroid-induced ocular hypertension can lead to the steroid-induced glaucoma following the prolonged use. Other potential side effects include the opportunistic infection and cataract formation. Topical timolol has been used as an alternative to steroid for the treatment of pyogenic granuloma. According to the OCATEL report outcome in the 4 children who had a conjunctival pyogenic granuloma, all cases complete resolution occur within a treatment period with no recurrence for at least 3 months. There were no adverse event from the timolol during follow-up. According to the D. Mary et al. Reported outcome in 17% with ocular pyogenic granuloma, 88% of the patient had complete lesion resolution with the mean treatment duration duration approximate 3 weeks, and no adverse event or recurrence with the mean follow-up up to 9 months. In our study, success rate with the use of topical timolol with 82% of patients responding to the topical therapy with minimum fluctuation of intraocular pressure. Now conclusion, topical steroid therapy, although convenient, is not free of side effect. Topical timolol has been used as an alternative to steroid for the treatment of pyogenic granuloma. Topical timolol cause significant but reversible reduction in IOP. In all patients, no adverse reaction were reported. These are some references.
Yes, would you like to ask some question?
Thank you. I just have a question. What exactly was the rationale in adding intraocular pressure in your study?
Ma'am, intraocular pressure increased, might increase during the treatment, but reversible after the stopping with the treatment.
No, you mean to say that you're given timolol and you expect that the pressure will rise?
Sorry, ma'am, decrease in pressure.
Plus, you have said that the intraocular pressure was not significantly. According to your, please, can you quote to me how much was the pressure decrease? There was, if I'm not mistaken, 4 to 5 millimeter pressure decrease. Ma'am, which was the instrument that you used to check the pressures?
Ma'am, applicant tonometry.
How old were your patients?
Ma'am, it differ from the 7 to 45 years.
7 to 45 years.
Yes, ma'am.
That's a huge age range. What is the mechanism of action of timolol for in the use of pyogenic granuloma?
Ma'am, timolol decrease the inflammatory mediator which causing the pyogenic granuloma.
And how long did you use the timolol? You used timolol for decreasing it?
Ma'am, 8 weeks.
Weeks.
Right. Thank you.
Thank you.